excision. Blepharoplasty or eyelid surgery. In recent years, eyelid surgery has become a very popular technique, especially among men. Bags under the eyelids, drooping eyebrows, and wrinkles generally create an unwanted appearance of tiredness, sadness, and aging. Eyelid surgery attempts to correct all of these in order to provide a younger, more cheerful look. To begin with, it is very important for the surgeon to understand the patient's expectations in order to clearly discuss the results that can be obtained in each case. Secondly, a complete preoperative examination must be undertaken of the eye function. During this examination, the possibility of excess looseness of the lower lid will also be tested. The eyeball and the rest of the orbital structures are surrounded by fat with an anterior section contained or held in from the outside by the orbital septum. This orbital fat is confined or contained in several packets or pads, 3 behind the lower lid and 2 in the upper. With the passage of time, the containment provided by the orbital septum progressively lessens so that the fat pads protrude, thus creating the so-called palpable bags or baggy eyelids. Since the excess of both fat and skin contribute equally to the aged appearance of the eyelids, the treatment should always address the specific factors causing the problem. At times, drooping of the tail of the eyebrows is significant enough to require an eyebrow lift rather than a blepharoplasty. The procedure is normally done under local anesthetic, with or without sedation, and on an outpatient basis. On the upper lid, the surgery is generally based on the elimination of excess skin, a portion of the orbicularis muscle, and of internal fat. The resulting scar will be located and hidden in the fold of the upper lid. On the lower lid, the incision is made about 2 mm from the edge of the eyelash line. The fat pads are extracted, and as a general rule, it is important to be conservative when eliminating excess skin. If the lower skin is very loose, we can tighten it by using different techniques. In young patients with noticeable fat pads and without excessive skin, we can take an approach that uses a transconjunctival incision in which the scar will not be visible on the inside of the eyelid. Your surgeon will recommend rest and cold pads for the first 24 hours after surgery. It is normal for there to be bruising and swelling of the eyelids. Tearing and a certain intolerance to light generally occur during this period. Therefore, if necessary, your surgeon will prescribe the appropriate eye drops or medication and will advise you to wear sunglasses. It is important to know that the incisions made during your surgery are placed where they will be difficult to see after a few months have passed.